How does the urinary bladder store urine, and what are its features? Imagine a balloon that can stretch and hold a liquid 4 hours without bursting. That's similar to how the urinary bladder works in your body. It's a hollow, muscular organ located in the pelvic area. Its main job is to store urine made by your kidneys until it's time to go to the bathroom. The bladder can expand and contract, which helps it hold varying amounts of urine comfortably. When empty, it looks like a small, wrinkled pouch. As it fills, it becomes more oval or elongated and can hold up to about 1 liter of urine in adults. The inside of the bladder is covered with a special lining called transitional epithelium. This tissue is flexible and can stretch without tearing. When the bladder is empty, the lining forms folds called rugae. These folds flatten out as the bladder fills, allowing it to expand smoothly. This way, the bladder can increase in size without a big jump in internal pressure. The bladder wall has several layers. The innermost is the mucosa, which is made of the transitional epithelium. Beneath that is the submucosa, a supportive connective tissue with blood vessels and nerves. The muscular layer, called the detrusor muscle, is made of smooth muscle fibers arranged in different directions. This muscle contracts during urination to push out urine. The outermost layer is called the adventitia, which keeps the bladder anchored in place within the pelvis. The shape of the bladder changes as it fills. When empty, it's roughly spherical. As it fills, it stretches upward into the abdominal cavity. The base of the bladder has a triangular area called the trigone. This area is formed by 3 openings: two from the ureters, which bring urine from the kidneys, and one leading to the urethra, the tube that carries urine out of the body. The openings from the ureters have small flaps that act like valves. These prevent urine from flowing back into the kidneys, which is very important for kidney health. The bladder also has 2 important muscles called sphincters. The internal urethral sphincter is made of smooth muscle and keeps urine from leaking out involuntarily. The external urethral sphincter is made of skeletal muscle, which you control consciously. When your bladder fills to about 300 to 400 milliliters, stretch receptors in the bladder will send signals to your brain. This creates the urge to urinate. When you decide to go, the brain signals the muscles to contract, the sphincters relax, and urine flows out through the urethra. All these features work together to keep urine stored safely and released at the right time. The bladder's ability to stretch, its muscular walls, and the valve-like openings from the ureters help maintain continence. Meanwhile, the nervous system coordinates the process, making sure you can control when and where you urinate.